Hello everybody, good evening. Today we are going to talk about egg freezing and gynecological health. Let me introduce myself. My name is Angel Anjali. My background is women's health movement coach and certified nutrition counselor, and as well as the founder of this platform. So today we have amazing guest coming, Dr. Jabbour, Joseph Jabbour, and I'm going to read his bio while we are waiting. So, as a RANSCOG certified fertility specialist, OBGYN, and advanced laparoscopic surgeon, Dr. Joseph is uniquely qualified to provide you with medical care and support across every life stage. Based at Southside OBGYN in Brisbane, he offers comprehensive services across all areas of women's health, pregnancy, and fertility. I'm going to try to send him a request. There is no request. All right, okay. Dr. Joseph S. Okay, so, all right, okay, so he has joined in. Okay. All right. Oh, here he is.
Hi, yeah, sorry
Sorry
about
to
that.
wait around. Welcome. Thank you so much for your time.
That's okay. Thanks for having me, Ange.
Yeah.
Thank you for the opportunity to speak with you. And yeah, looking forward to it.
Yes, I was trying to that you spooked me.
Yeah, sorry about
So
that. I
yeah,
was trying to figure it out, this thing, but I think it's working well now.
yes. Welcome everybody. Thank you so much for being here. So I was reading your bio halfway through and I wanted to figure this out as well. So going through, Dr. Joseph is a joint director of Southside OBGYN, a state-of-the-art women's health clinic in Holland Park, designed to support women throughout all life stages. His areas of expertise include pelvic pain, endometriosis, polycystic ovarian syndrome, menopause, IVF, and pregnancy care, including high-risk pregnancies. Thank you so much, Dr. Joseph, for being here and, the amazing work you do. And yes, before we start, I just wanted to read a little bit of disclaimer. So this talk is all about to bring awareness, not a specific medical advice for anyone. If you need support, please directly contact Dr. Joseph or your healthcare practitioner, right? And would you like to add anything else, Dr. Joseph?
No, I think that that's fair. Yeah, no, we can start when you're
We
ready.
can start.
Yeah,
All
100%.
right. Yeah. So to start with, can you explain to us, for the general people, what is egg freezing in a simple term? And, who are new to this, of course, and curious about this topic.
So I think, like we were chatting before, Ange, I think egg freezing essentially is kind of like an insurance policy for women who are wanting to postpone their fertility. So I think when you look at historically what's been going on over the past 20 years or so, is that we found that women are postponing their fertility to a later stage in their lives, whether that's because they're keen to um, uh, travel the world, get better education. They're planning to live their lives.
Have a little bit of freedom, right?
That's right, 100%. So
Yes.
it's no longer the case that most women are having their babies between the age of 20 and 30. I mean, most of the highest percentage of women now having their babies is actually over the age of 30. So So the issue becomes maybe the first baby between the age of 30 and 36 is not that difficult to conceive naturally. But when you try to conceive that second baby or even that third baby, if you want to expand your family, then it becomes a little bit more challenging. We know that the quality of the eggs as a woman ages does go down, unfortunately. And this is why when a woman is trying to conceive after the age of 35, sometimes it's a little bit more challenging. So, uh, I always tell my patients, if you're planning to, insure your home that you live in, you insure your car, I think it's very natural for a young woman to want to ensure her fertility. And this is what egg freezing is all about. So essentially, you undertake an ovarian stimulation cycle, which means you do a bunch of injections that will stimulate your ovaries to produce lots of follicles, and then you aspirate these follicles. You aspirate the follicular fluid from these follicles, and then you freeze the eggs. And the eggs are frozen, and they can be frozen for posterity. So you can leave them in liquid nitrogen for many years. And then, say, for example, you meet that person, or you decide you want to do this solo at a later age. A woman can have these eggs thawed and can use them whether she's 38, 39, 40, or 41. So this is where egg freezing is important.
It's almost
Um,
like a time freezing, right? Time
Absolutely,
freezing
it is.
time freezing your baby,
Yeah,
your eggs, and then later in life, and then you will have the same healthy egg for your,
that's right. So the eggs that you produce at whatever age, as soon as they are frozen and they're frozen in liquid nitrogen, the quality of these eggs remains the same. So you can use them at any stage in later life. And yeah, so that's right.
Yeah, so that's yeah, but in back in the days we could never imagine that this day would come, right? And and for women, it seems to give them a freedom, the choice, to have if they don't want to have a baby now, they can have in future, or have the healthy baby, right?
That's right. So the most important thing to have is choices, and you don't want to find yourself in a bit of a pickle when you're much older and you're having to do multiple IVF cycles and you have to, it becomes taxing both emotionally as well as financially. Whereas when you're using eggs frozen at a younger age, you have a much higher chance of being able to conceive. And it gives you the opportunity to have that second baby and third baby if you wish to do so. I still encourage my patients when they come back to use these eggs. They go, oh, I've got a new partner now. I'd like to use these eggs. I'm like, well, have you tried naturally first? Because you do have that opportunity to try naturally. But
Yes.
then obviously you have them as a backup in case you need them. And with the technology that we have these days, the survival rate of these eggs when you thaw them
Yes.
is about 90 to 95%. So when you've got
Wow.
eggs frozen, if
Yes.
you've got 10 or 15 eggs, you can almost be guaranteed that at least, you know, 8 out of the 10, if not more, 9 out of the 10, uh, as well as around 13 out of 15 eggs will survive that full process. So it's a good opportunity for you to be able to conceive using these eggs.
Yeah, so that's incredible. So how does egg freezing fit into the broader picture of women's gynecological health and fertility care?
So, I mean, there's lots of different reasons why you would be doing egg freezing. I see all sorts of young women coming to see me, also women over the age of 30 who are still young, let's be honest. But, if you have conditions such as pelvic pain and you end up doing laparoscopic surgery and you find endometriosis, and in the same token, you do an egg reserve test and your AMH is a little bit low, or your ultrasound scan shows that you have a low antral follicle count, which means that your egg reserve is low. In these circumstances, even though you're looking at your gynecological and pelvic health, you can still consider things like egg freezing, and this is where I encourage my patients. okay, well, we've done the laparoscopy, you've got endometriosis, you're not ready to have babies, your egg reserve potential is a little bit low. By freezing eggs now, you can give yourself a much better opportunity in the future should you
Yes.
want to, start your family. And there are other scenarios where you just need to strongly consider egg freezing, and these are in circumstances where you need treatment for a cancer or something like that. So I get lots of women who come and see me, for example, who have had. So, for example, recently I had a patient with a lymphoma. She was going to undertake chemotherapy. So, what we decide to do is to freeze some eggs prior to undertaking that treatment. So it's not only for gynecological health; it's for your broad health as well, where egg freezing can be
Use.
useful. Yeah.
Yes.
Yes,
Yeah.
absolutely.
So, yeah. So I just wanted to say this to our viewers. If you have any questions, pop it in the comment section. So Dr. Jabbour, yeah, can answer your questions while we are talking. Yeah, we will go through it. So welcome everybody. If you just come in, thank you so much for being here. Today we have amazing Dr. Jabbour with us, and we are talking about egg freezing. So what roles does egg freezing, I think we almost touched in this one, egg
Hmm.
freezing play in giving women more choices when it comes to planning their reproductive health? I think we
Hmm.
already touched in this, right?
Yes. So I can elaborate a little bit more on that. So, we've done lots of studies where we've looked at whether women are actually desiring more children than they're able to naturally conceive. And there was a big study called the Hilda report where they looked at more than 17,000 women a few years ago. And typically, a lot of women were wanting to have more than one baby, but a lot of them were actually postponing it to a later stage. So I think when it comes to egg freezing, it does give you that option to expand your family and to have more than just the one baby. And sometimes it gives you that opportunity to have that one baby if you're planning to postpone it a little bit too much, too long. So, this is where egg freezing is crucial in a social type of scenario, and then you've got your medical egg freezing. So medical egg freezing is when you're planning to freeze your eggs just because something is happening to your body where it's going to be detrimental to your ovaries.
Yes. Like you
Whether that
said earlier, you mentioned about the cancer, right?
100%. Yes.
Yes.
Whether that's gynecological cancers or any type of cancer, because we know that chemotherapy or radiotherapy can be detrimental to a woman's eggs and her ovarian tissue. So in those circumstances, you freeze eggs so that you can give that person the option in the future to be able to conceive.
Yeah, so it can be for the social aspect as well as the health aspect. If
That's right.
yeah, if you get into some sort of disease or some sort of the high risk diseases, right?
Yes.
Yeah.
The good thing these days is that a lot of general practitioners and a lot of cancer doctors as well are very much, abreast of all of this information. So they're aware that these options are crucial to be discussed with the patient
With the
before you
patient.
undertake, chemotherapy or
Chemotherapy.
radiotherapy. That's right. That's right.
Yes. So that's yeah, it's almost like a gap that the practitioners should talk about before the patient goes into chemotherapy.
Absolutely.
And like we were talking about earlier, right? So that when you're with the other practitioners, you try to mention that to the other
Yes.
practitioners, right?
Yes. So, I mean, egg freezing. I do a lot of these talks in GP events as well as I do some teaching for RMOs, junior doctors and residents, and this is a topic that I definitely speak of a lot. And it's not just educational in terms of the layperson and the potential patient, but it's also to educate general practitioners and other clinicians to and guide them towards, mentioning this as an option to a woman, because I think it's important. I've had lots of women over the years who have come to me, who have said, they weren't really informed about the need to do this, or nobody had, mentioned it as an option. So this is why it's crucial, I think, to give women options. But I think even in the context of social egg freezing, I think it's important for women to know that they have options with that. Uh, so I do see a lot of women that come to me at the age between 30 and 35, and they're not sure and they want to postpone things further. And I always say, let's do this, let's do it now, rather than have that regret later on.
Yes.
Even with frozen eggs, it's not guaranteed to
Yes.
have a baby, but at least you have the opportunity to
Option.
try. Yeah, the
Yes.
option. That's right.
Yes. Yes. So have the higher possibility and as well as the healthier babies,
Yes.
right? Yeah.
Yes.
So and this is almost like this is not just for the public to know, but also crucial to know for the practitioners themselves, them as well.
Yes. 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 Absolutely.
Yeah. So how can gynecologists support women and the community to make informed decisions about whether egg freezing is right for them?
So, I mean, look, from my point of view, seeing as this
Yes.
is my bread and butter,
Yeah.
I'm always talking to people about this.
Yeah.
I'm always chatting about this. I see young women coming to me for whatever reason, and I always put that seed. I just always discuss that as an option, and the reason why I always discuss that option is very simple. I see so many women over the age of 35, 36 who sometimes struggle with IVF, and because it's not a guaranteed thing, IVF, lots of women sometimes, they postpone their fertility and they say, oh, there's IVF in the future, we can make it happen with IVF. But unfortunately, IVF increases the success rate of conceiving from that type of slope to that type of slope. So it does improve your chances, but it certainly is not a magical wand that will all of a sudden make you conceive
Yes.
and have that baby. So I think this is where education is key and it's important. In the same token, I don't want people to be, you know, really stressed about this either. So I see sometimes women coming to me at the age of 19, 20, and they're, egg freezing. And I always say, look, you may be a bit too young to do it right now. Uh, you don't want to do it too young as well, because you're much less likely to use these eggs in the future. But I think once you hit that age of 28, 29, this is when you need to start, contemplating whether this is something that you need to do.
Yes.
Now, the other thing as well that I wanted to mention is potentially freezing embryos, because sometimes you might be in a relationship and you're a couple and whatever, but you're both wanting to postpone childbearing to a later stage, or you're planning to have, 3 or 4 babies, for example. I just saw a recent couple that just saw me a few days ago, and she's 33, he's 36. They're planning to start conceiving next year, but they said, look, we're planning to have 3 or 4 babies. I am starting at the age of 33. Do you think I
Wow.
should be doing
Yeah.
IVF? And I said, yes, because if you're planning to have your third baby at the age of 40, because you're only 33 now, it's going to be harder then. So that's another thing as well. So it's not just egg freezing, it's also embryo freezing is an option for you, especially if as a couple you're planning to postpone things. Uh, and I think the thing that's made me want to discuss this further is the fact that I've seen so many women in their 40s who, do multiple IVF cycle. It's very
Yes. My
costly, and
friend, yeah, my friend Angie is saying from Clarity and Me OT, she's saying, yes, didn't have that option and will be educating our daughters on this from someone who did 20 full IVF cycles at 38.
yeah,
So, yes.
yeah,
So, to being honest with you, I have no idea what, people who has been through the IVF cycle go through. But I have heard some of my friends, they tried but it wasn't successful for them. And it was very taxing, in,
it's hard. It's
yes.
hard.
And it was, yes. And so, yeah. So the egg freezing would somehow maybe possibly it would make it easier later in life.
For sure, for sure,
Yes.
for sure. I think, for example, that 38-year-old friend of yours had she frozen eggs at the age of 30. We know that the quality of the eggs at the age of 30 are far better than the age of 38. We know that the egg quality, if you plot it on a graph, it's almost very stable in the 20s. In their 30s, it starts going down a bit like this. But then once they hit 35, especially 37, it's a very slippery slope. And it does become much more challenging for women
Yes.
at that age, unfortunately, to conceive. But it's also sometimes dependent on where you're getting your IVF cycles done. You know, sometimes there are labs that are a little bit better than others. You know, sometimes you may not have investigated things as thoroughly. It may be a situation where, you know, you didn't investigate for other causes, or where there are issues with implantation
Yeah.
failures. So there's a lot to it, unfortunately. But you can
So,
cross, yes?
yeah, my friend is saying egg donor child at 45 years, not enough education on eggs age.
Yes. Yeah, yes, that's the thing. I mean, sometimes, I mean, I deal with a lot of egg donors as well, and egg donor recipients as well, egg recipients. And I mean, making that decision can be a little bit tough, but it's one of those things that sometimes, in order to be able to conceive and have your baby, you just have to consider this. And I mean, I do cycles for women aged 44 and 45, and the success rate is, you know, somewhere around the 5% mark, and sometimes even less depending on the health of the person. So it is tough, you know, and when you're having to do multiple cycles, like you said, it is quite difficult psychologically, financially, and even egg, you know, receiving eggs as well. It's not very easy. It can be sometimes a bit expensive as well,
Yes.
and you have to do a lot of counseling as well, and but yeah. So if you have the option of having younger eggs, then that will give you the best chance for it to succeed.
Yeah.
So, so yeah, yeah, yeah. Um, this is why I think it's important to mention egg freezing and educating people about that option.
Yeah.
And hopefully this will shed
It
some
will,
light on things.
yeah, it will get better in time. Like my friend is saying, we are going to educate our children around it as well. That possibilities of, egg freezing and what are the advantage of it.
Yeah,
You know?
absolutely,
Yeah.
absolutely.
Yeah, so we could keep talking about this for ages. And if
Mm.
anyone has any question, please put it in the comment section. And while we wait, oh, my friend is saying we don't know about the genetics from donors either, you know?
Well, you know, it depends on
Does
where
that
you're
matter?
getting. Well, it depends on how you're getting these donor eggs. I mean, these, I mean, well, for example, when you're going through Monash IVF, which is the company that I work with, we screen all of our egg donors. So if you're donating eggs, whether that's altruistically, whether you're, you know, doing it as a friendly gesture or something like that, or if you're using a bank, an egg donor bank, we screen women now who are donating their eggs for a lot of genetic abnormalities. So these days it's a bit different. I'm not quite sure when the egg donation occurred, but these days we
You
actually are
can
quite.
check, you can
Oh
check
yeah,
all of that, screen
definitely.
all of that. That's
So definitely.
important.
So essentially, what you're doing is you're screening the egg donor, and
Yes.
then if that egg recipient has a partner, and we're using his sperm, because sometimes they could be using donor sperm and donor eggs. So you screen the man and the male. For any genetic abnormalities. So if they share any genetic abnormalities, then they're not really compatible. In those circumstances, it may be a better option to get a different egg donor. But yeah, we do know the genetics now, and we have lots of options in terms of genetic screening. I mean,
Yes.
we've got genetic screening now of more than 400 genetic abnormalities, so it's getting better and better.
Yes. No, that's
Mm,
the technology is amazing, and
mm.
how, yeah, it's incredible. It's mind blowing. So thank you everyone for being here. Dr. Joseph, we are really grateful to have you here. And before you go, please let us know where people can find you.
Well, it's very easy to find me. I work at Southside OBGYN. So you can contact my rooms, 334-54947. But I've got a good online presence as well. So you can just Google me. You
Yes.
can get all the information about me. I also do lots of telehealth as well. So if you need second opinions or whatever, and you're
Yes.
down on the Gold Coast, or you need some information, I'm more than happy to do a telehealth. And I'm very accessible to my patients as well,
Yes.
via email also. I try not to do too much of the Instagram medical consultation, simply because sometimes things are lost in translation when you're doing it in this forum. So I prefer that if you need any information, then just get in contact with my rooms, and I'm more than happy to have a chat to you.
Yeah, amazing. And Violet says best OBGYN around. So
Yeah, yeah.
you're the
Yeah.
best one. All right. Yeah, we would like to happy to promote talks. Thank you so much. My friend is occupational therapist, and so that is we were talking about. And love that you do telehealth. Best OBGYN. Don't ever retire. Ha ha. Oh, well done. So thank you so much for being here, Dr. Joseph, and everybody who've been here. And if you need to contact Dr. Joseph, we're going to put all the details in a content down below. And yes, and thank you so much, everyone. So we will see you in the next one.
Okay, thank you. Have a good night.
There, you too. Thank you, Dr. Joseph. Bye-bye. Thank
Bye.
you. Bye-bye.